Just because you're pregnant doesn't mean that this is a good time to just give up and slob out. We all know that exercise creates happy hormones, and at a time when your hormones are all over the shop, this is an extra good reason for creating those. Also, it's really great to get a bit of extra body confidence at a time where you might be putting on a bit of weight here and there. Any time is a good time to start exercise. Whether you're pregnant or not, if you're not exercising, you definitely should start right now. The American College of Obstetricians and Gynecologists would suggest that you can continue with any exercise that you were doing prior to pregnancy once you get pregnant. So for example, if you were running, then it's absolutely fine to keep going with that until a point when you don't feel comfortable with it anymore. If you weren't exercising at all, then I'd highly suggest that you stick to really safe exercising like swimming or walking, or even prenatal specific yoga and Pilates. You know that everything you're going to be doing is going to be safe for you and your baby. There's loads of resources online. We're going to have loads on moveyourframe.com as well, so keep an eye out. And if in doubt, just ask your midwife or doctor. So I'd suggest wearing a pair of leggings, maybe get a size bigger than usual once you sort of get past your first trimester. They'll come in handy after your pregnancy anyway. Get yourself a nice loose vest top, something from Topshop, H&M, doesn't need to be expensive. Get yourself a really good sports bra, no matter whether you're doing low or high impact training. So whether it's yoga or running, you still want to invest in that sports bra and protect those milk ducts. Absolutely, your baby's going to benefit from you exercising. It's going to help reduce your stress levels, it's going to help you sleep better, it's going to improve your energy, it's going to ease any discomfort. And as your baby's part of you and growing inside you, anything that positive that you can do for yourself is really going to impact your baby. So how long can you exercise when you're pregnant? So it's completely dependent on the person. I think it's really important that you listen to your body. When things start to ache or don't feel quite right, then you stop those exercises and start looking at sort of lower impact things. For example, I ran up to 6 months, but then I felt that my baby was quite heavy and it was starting to sort of get to my knees and my joints. So I stopped and I sort of concentrated more on walking and then yoga and Pilates. We do a class called frame bumps, which is fantastic because it works the arms and it works the legs and it's all completely safe. And there's loads of people coming into frame and doing that until about the day before they give birth. So it's absolutely fine to go as long as you want, as long as you're feeling fine and comfortable. If you're not feeling great, then take a day off, it doesn't matter. Just give yourself a bit of a break. Yeah, absolutely. The stronger and fitter you are, the better you're going to be able to physically and mentally prepare for labour and get through it. Even if you have a tough labour, if you've got strength and stamina, then it's going to feel a lot easier and you'll recover quicker as well. Also, you want to go into sort of being a new mum with a lot of strength and stamina because it's not easy. There's a lot of long nights ahead and you want to be able to push through them and have some really lovely times with your new baby. When you've just had a baby, it's not the time to be worrying about getting back to be fit, to lose weight. You want to take a good few weeks out to just sort of relax, chill out, bond with your little one. Depending on what your birth was like will totally dictate how quickly you can get back into exercising. For example, if you had quite a nice easy birth, then after 6 weeks, once you've been to a 6-week check with your doctor, then you potentially can start to do some sort of nice low impact exercises and get those abs back into shape. If, for example, you had a C-section, then you're going to have a little longer to wait until you want to get back into it. So again, it's something that's probably worth talking with your doctor, but also just listening to your body and sort of seeing how it feels.